the goal is going to be to get you a much, much more resilient digestive system and gut microbiome. And that comes from having adequate stomach acid and a lot of robust, good bacteria and feeding those things. That's why, adding all the fruits and vegetables, adding green tea, adding fatty fishes, adding herbs and spices. Like we need to start thinking about how we're going to feed our microbiome, not just what can we not eat, Hi, and welcome back to the Integrative Women's Health Podcast. I'm your host, Dr. Jessica Drummond, and we're here today for part 2 of our episode with brilliant physical therapy student, Terry Brown, who was so kind to share with us her personal case study experience of post-viral syndrome, long COVID, and the year to 18 months of constant chronic infections that she was dealing with, the impacts to her overall health in the midst of trying to balance her own healthcare with a busy physical therapy program schedule. So, as you know, if you're following the Integrative Women's Health Institute, we have a 7-step protocol that we utilize to give people a sort of step-by-step system for optimizing their health, no matter what conditions we're talking about. So in step 1, we're talking about nervous system regulation. In step 2, we're co-creating a vision and goals for the client, how they define health. In part 3, we're talking about the measures, the labs, the history, the insight and information from our client, their health story. And in step 4, we do education and recommendations that, again, we're co-creating and collaborating with our clients. So welcome back, Terry. It's been about a month now since we last connected. How are you feeling? How are the recommendations going? And then we'll finish up steps 5, 6, and 7.
Thank you so much for having me back. I've been doing well. I've taken into consideration plans of our exercise things we discussed, like cutting back where I needed to cut back, and then, maybe increasing other parts of my exercise. And then I have been taking some of the supplements we talked about, just like apple cider vinegar, some creatine, and a few other things just to my daily diet and supplement intake. And then, like I said, cutting back on running has been helpful for me. I believe I am not feeling as exhausted throughout the week, and my gut health has improved a little bit. It always is kind of at a baseline level, a little bit off, but I've been doing well. I have fingers, don't want to jinx it, but I have not been sick with anything other than just seasonal allergies since we last spoke, which before I spoke with you, my pattern was about a month between each pretty significant diagnosis sickness. So hoping that it stays this course. But I'm doing well. Yeah.
Yeah, thank you for that update. And that's very encouraging. It is interesting. There's a paper that just came out showing that seasonal allergies are increased for people that have had COVID and long COVID. So hopefully they're not worse for you. But that's an interesting insight to share in terms of circling back to step 3 around your own health history. Is seasonal allergy something you've always dealt with?
It is a normal thing for me, correct? I can't say yet if it's been better or worse. I've just been doing my daily allergy medicine ritual, but I do know if I was not taking that, I would be potentially more sick than I am now. And I did have a sinus infection maybe a month and a half back that lasted a good long while. And it did take me longer to get that out of my system than maybe 3 years ago it would have.
Mm-hmm. Yeah. And so that was before we met. So it's good that in the last month, it hasn't progressed to a sinus infection, which is showing maybe some more immune modulation, but also histamine is a big factor when it comes to post-COVID immune activation. Are you taking, what is your allergy medicine? Is it some kind of antihistamine?
I take Zyrtec once a day.
Yeah.
And then I do a prescription nasal spray on my more severe days.
That's perfect. Yeah. So, all right. So previous to our talk last time, some of your chief complaints were the digestive issues, which were really sort of long-standing. That was part of your I would even say pre-existing vulnerability. Would you agree with that?
I would agree, yes.
And then post-infectiously, a lot of fatigue and just constantly getting an actual new infection every month or so. So let's talk a little bit about your daily schedule. So in step 5 of our our protocol, our system is essentially saying, okay, how are we going to implement the changes we recommended? You added some nutrient supplements, made some shifts to your nutrition program, changed how you exercise from being more intense to being more recovery focused and more kind of zone 2 training, kind of low grade, consistent training, but also strength training. So talk about how you fit that in.
Yeah, so my phase of school, I think with probably most graduate programs, each block semester it changes a good bit. I'm finishing out my second year, entering my rotational year.
Mhm.
So I'm kind of on a downhill slope, thankfully, about like class intensity. Over this past summer, when I was kind of my sickest, my class schedule was 8 to 5 on campus every day. And then I would typically have about 4 hours of homework and prep work for the next day each evening. So that was my really intense, heavy semester. Now my days look more kind of on that 8 to 3 range. Um, and that includes some extracurricular activities as well. So a much lighter schedule. For exercise, it's just a daily thing I started working into my routine while I've been in school just to help with stress, to kind of give me some like endorphins to help me feel better about myself and have energy to complete the second half of the day. I always get that 2 o'clock slump. And so
Mhm.
if I do exercise around that time, I usually have the energy to take me through 10 p.m. But that's the main thing. I already had some patterns set up. And so I just adjusted those pre existing patterns, which has been helpful. However, there was a phase of school, especially my first year, where I did not have a good workout routine, um, and implementing it was hard when I was so sick that first year, but it was eventually helpful once I kind of got past like the first 2 COVIDs and the mono. Then I could kind of start getting back to the gym.
Yeah, absolutely. I mean, that'll take anybody out, not to mention a schedule
Mhm.
of basically 8 a.m. to 9 p.m. That's rough.
Totally.
So you've been adding apple cider vinegar and adding that to your meals. Any shifts in your actual nutrition plan? And then kind of update me on your supplements.
No major shifts to my nutrition plan. I'm at all times pretty cognizant of like protein intake, and I try and focus on healthy, as healthy as I can eat as a grad student, but I try and focus on cleaner eating, and more like whole fats, proteins, stuff like that. I wouldn't say I've had a significant change in what I'm eating on my own. However, I did start including the apple cider vinegar, and I try and
Hmm.
take it on like first thing in the morning on an empty stomach, and it sometimes helps my stomach regulate throughout the day better than it did for a while. I've started doing the creatine after the workouts, and I have definitely noticed that helping with my recovery, my muscle recovery. I just been continuing with my daily and my omega-3. I was already taking
Okay.
those regularly.
Hmm.
And I take calcium because I don't eat dairy, so I
Hmm.
try and supplement a little bit extra that in.
Okay. Do you take any magnesium supplements?
I have some. I have not been in a good routine of
It's been a
it, but I
while.
have them. Yeah.
Okay. All right. Good. So how are you feeling at this point? You said your energy's up a little bit, digestion's a little better. Let's maybe refine that. So, two things. When we move into kind of step 5 is we'll get this get integrated in your schedule. And it sounds like you're really already doing a pretty good job of that. It's just a matter of tweaking, getting your exercise in or between noon and 2 so you kind of stay energized in the second half of your day, adding the apple cider vinegar in the morning. And you could even add it before each meal if you needed a little bit more boost of that. We could integrate that. Your nutrition plan is pretty clean, the best that you have access to, and you're clear on what your schedule is and trying to get to sleep. So that wasn't a huge shift, but just adding, and I think that's something for our students and coaches and anyone listening to this who is interested in women's health coaching, that it doesn't always have to be massive shifts in your lifestyle.
Mhm.
Sometimes in your case, it was just shifting intensity of exercise, but keeping the time the same, shifting a little bit of like a slight supplement regimen shift, but again, same timing. So it's changes that are able to be more sustainable because we didn't overhaul your lifestyle in the midst of a very busy life stage.
Definitely.
So you were good at with integrating it into your schedule. Did you feel like you needed any support? Just in any way? Did you find it was hard and that you could have used some support along the way with anything?
I think for these changes, as you mentioned, like I kind of already had maybe the blueprint, the foundation set, I just kind of added a few extra things in or swapped stuff out. I didn't notice times when I was really needing support. However, if anything, you allowed me to kind of like give myself grace. I am pretty hard on myself, like I feel like most people are. And so the days when I'd be like running and like I would fatigue after a mile or I'd be feeling awful, I'd be like, you have to go, you have to keep pushing. Like you need, I would kind of be a little bit more hard on myself than I should have been. So like, after having our talk and being like, it's okay that I don't run, right now in this phase of life, like I can do other forms of cardio that keep my heart healthy, keep my body happy, but maybe aren't exerting or exhausting myself the way running was.
Yeah.
So if anything, it's kind of like I can feel like tell my voice inside my head to quiet down. 'Cause I'm like, no, it's okay. Dr. Drummond said I could hold off on running. So that's probably been like more of a grace factor than anything. I wouldn't say I've needed support. It's been like I've finally given myself the grace that I've probably needed to give myself for this past 18 months of sickness.
Yeah, I really think that's important for a couple of reasons. One, the data for women on things like zone 2 cardio, which I like that's essentially like power walking, right? It's like 75% of your max consistently for 45 minutes. There's a lot of benefit in terms of fat burning and things like that. But what's very interesting about that is most of the research is actually showing a much more significant benefit for men, and that women should do it. Of course, that kind of slow, steady cardio is nourishing for the heart and vascular system. But what ends up happening is women have a tendency to push past zone 2 into the more intense cardiovascular exercise, getting their heart rate closer to, 70 or so percent is like the top end of zone 2 cardio training. 70% of heart rate max, which is 220 minus the age, or there are a couple of
Mhm.
other more precise equations that you can just Google, but roughly 220 minus your age, 70% of that would be the top end of zone 2. But because women, we're sort of socialized to exercise, not, for our own mental health, but also there's this sense of having to do enough and having to maintain our weight enough and having our body look a certain way enough. And, so the tendency actually in the literature is that women don't keep their heart rate low enough. They're actually exercising too intensely for too long. There's a lot of benefit to the cardiovascular system for intermittent intensity. So things like HIIT training for 10 minutes a few times a week, that high intensity intervals. But prolonged high intensity is actually somewhat damaging and and is more damaging for women because we can tend to do it more. Does that make sense?
Definitely.
Yeah, so it's really valuable to make those little shifts in awareness, and it's so beautiful that you were able to see that you still got a lot of nourishment for your heart, a lot of muscle building. Your muscles are recovering now because they're getting a little extra nutrition post workout directly with the creatine. So just minor shifts. And, so for people that might be integrating these kinds of things, having a fitness trainer or accountability for you, accountability was not the problem at all. It was more about overdoing it. So we certainly have a lot of clients who are doing that their whole lives. So the accountability is around quieting the voice, that it has to be intense and perfect and every day, and pushing through. That pushing through voice is very strong.
Definitely. And I know we did discuss the cycle, like working around my cycle. And I did try
Mhm.
and be much more cognizant and respect my body in its cycle phase as well in this past month. So, like during my menstruation week, it's okay if I only go to the gym 3 times instead of my normal 5 times because I'm tired and I need extra sleep and I want to eat food and go to nap. So,
How do you feel about the recovery as a part of exercise, if you will, almost the other side of the coin in the last month compared to what you were doing the year before?
I think in the year before, my routine was not as regular with going to the gym, so I probably had a lot more of that guilt, and so when I
Mhm.
would go, I think I would really, really overdo it. Maybe stay there for, like, an hour and a half to 2 hours, and then I was already at such a high, like, mental stress load. I probably wasn't sleeping well. It's, like, the kind of phase of school where when I do sleep, I'd be dreaming about school and tests and being behind in school, and so I woke up I never once felt like I left fight or flight mode, so it's probably like if I'd had a more routine schedule where I could have just done little bits of here and there and then not force that kind of intense all or nothing. Now I think I have a better approach to recovery. I try and focus on that like day in between of my hardcore strength training days. Um, I try and like listen to my body. Like if I'm just really tired and like getting in my gym clothes sounds like the worst thing possible, I'm like, okay, I'm gonna like respect that and read my book and do some busy work or school work, whatever I can get done at the desk. But I think just biggest thing is just like listening, and then the fact that I had a better schedule to start. I think it's kind of
Yeah.
hard sometimes to incorporate rest when you don't even have the routine set yet.
Yeah, absolutely. Absolutely. So, symptom-wise, how where are you finding that there are still some things you would like to work on?
I feel like my GI system always could use help. I did
Mm.
forget to say that I am taking papaya enzymes after
Ah,
every meal
okay.
that I remember. Just like yeah, digestive papaya enzymes. I feel like my stomach is never calm, but that's kind of been a normal for about 6 years of my life. And then of course I just want to hold on to this 1 month of health I've had. I would love to see this. Like we talked about, our original goal is 6 months of this,
Mhm.
where I'm not getting mono or getting the flu or getting COVID or getting pneumonia. So, especially as I'm entering my year of rotations in hospital systems, that's something I'm a little bit anxious about. And, we talked today, for example, about how I have 2 days I can miss for my block of rotations. And if I miss after that, it's going to start being differing my schedule. I'm going to make those days up. I can't, so that's kind of something I'm thinking about. Like, I really hope I don't have one of these sick phases I have had previously.
Okay. Yeah, that's important. And sort of a ridiculous request. I'd like to just highlight the ridiculous request from your hospital system, but I've been there. So any of us who've worked in conventional medicine really understand that.
It's tough.
So I think, first of all, strengthening your gastrointestinal system is really foundational to strengthen your immune system. So, how you manage your stress around this, and I think, well, it's a lot of pressure because you're at a very intense program and school, and obviously you want to graduate and get through it, and finish your studies. I think the more that you can continue to leaning into when you need to rest, and sometimes you're not going to be able to just sleep, for example, but I don't know if we talked that much last time about tools for just shifting your nervous system back to kind of the regulated state. And for some people, that can be as simple as slow, deep breathing, 6 seconds in, 6 seconds out, something like that. Do you find that if you make a little shift like that, or you listen to calming music, like you can go from a more fight or flight or freeze state into a calmer state?
I have used breathing techniques, historically, yes, for that kind of thing. Sometimes it doesn't always take effect. And sometimes I do the thing that I think a lot of people do, which is just going on my social media and like doom scrolling to kind of like, it doesn't help, it just gets your mind off of it, like a
Mhm.
quick fix. But I do constantly think about how I need to get my nervous system out of that like high fight or flight freeze.
Yeah.
Um, so I think I'm going to use the 6 in, 6 out next time. I used to do like the
Yeah.
cube, in four, hold four,
For
out four. Yeah.
That's also another good one. You can play with different like breathing exercises. The box breathing, four in, four hold, four out, four hold is also good. Or just keep it simpler and 6 in, 6 out. Um, One thing I would suggest is to find a nervous system regulation strategy that maybe you use before bed if one of your vulnerabilities is kind of dreaming about the stress of school, like you don't have that complete relaxation during sleep, that having a like hard stop time of when you're on any kind of devices or screens or whatever, and then a 15-minute per night, just simple mantra meditation. Like you literally just close your eyes, relax your whole body, close your mouth, breathe slowly and gently through your nose, and just think of one word. Could be anything, like could be the word one, could be, just any word. And notice your thoughts. Know that your brain is going to continue to think, and it will, but you're just going to do your best to let them go by. And sometimes you'll catch them, and you'll remember and then you'll stop, but it's a practice. And there are other forms of meditation, things like guided meditation. There are more, you could do that slow 6 in, 6 out breath for more like 10 minutes, taking breaks as much as you need to, 10 or 15 minutes. But there's value in that nervous system regulation in two ways. One is the daily practice, kind of like taking a walk, running, doing your lifting. Like it's like exercise for the nervous system on a consistent basis every day, whether you really need it or not. And then there's the quick fix, like the box breathing or the 6 in, 6 out, where you might do like 5 breaths like that, just in the moment of like, you're running around, you can't find your patient, this is taking too long, whatever. You stop for a second and just settle. Does that make sense?
It does, yeah.
So, are there any techniques that feel like you could fit in, for 10 or 15 minutes at night before bed?
I like the meditation thought. I like the way you said, let the thoughts are going to keep flowing, maybe like, but I can choose whether or not to grab onto them. I like that thought concept. I try and read before bed, just like a few pages of book because that'll make me sleepy. And the hope is I switch to those, thinking about the book rather than thinking about what I just closed on my computer. But I think kind of grouping together the reading and like a meditative slot would be really cool.
Yeah, that's perfect. And yeah, I love fiction reading at night is also wonderful. There was an interesting study that just came out about cognition. This is not quite the same as nervous system regulation, but if you like scents, essential oils or anything like that, rotating different scents, just having like a spray bottle with a little bit of water and essential oil of, I think the scents they used in this study were eucalyptus, peppermint, lemon, orange, rosemary, some very common ones. Just spray your room, like a quick spray or your pillow or your near your bed or something. And overnight, having that scent in the air and rotating them kind of keeps the brain having something interesting to attend to. So that might also be a way to sort of shut it off from the busyness of the day, the stressors of the day. So just something to consider.
That's cool. Yeah, absolutely.
And that meditation technique, I mean, there are a lot of people who teach it, but Emily Fletcher wrote a wonderful book called Stress Less, Accomplish More, is where I first learned that meditative technique. And, it's just kind of another nice resource. But the way she explains it, which I've always really loved, because meditation for me wasn't intuitive. I think, some people just love meditation. Some people hate meditation. For me, I really like it, but it's not something that came easy. I had to sort of practice. And that note that she said that, your brain is going to think in the same way your heart is going to beat. You can't just stop it. It's going to happen. So you just watch it is a much nicer way to approach it without stress. So you can't really do it wrong. Yeah.
Right. It's like staying under the surface of the water and like watching it ripple above you. That's what I'm going to like picture.
I love that. I love that. That's perfect. So that regular practice of nervous system regulation is really at the root of your gut health and your immune health, because both of those things are strained by stress. So your immune system is depressed by stress, and your digestive system becomes like a leakier small intestinal membrane. Your gut microbiome is not as healthy when you're kind of living in that constant state of stress. So the more often we can be in that nice, steady, calm state, and practicing that on a regular basis is, to me, just as important as lifting weights and getting your walks in and all of that. So we can layer that in kind of, you've done really well with habit stacking. So just connecting it with that reading a few pages that you're already doing at night. Sound good? Okay, great. And then digestively, so you're using apple cider vinegar, you've added creatine to help build your myofascial resilience, which is also a resource in terms of having more muscle is a resource for immunity because it's essentially a reservoir of amino acids. So we want to try to keep that up. And then probably we want to be a little bit more active in your protocol. First of all, I never recommend calcium supplementation without magnesium.
Okay,
There is some research that calcium supplementation can actually cause more plaques to develop in the vascular system. Um, so I actually recommend calcium foods more than calcium supplements. But
got
if
it.
you are going to take calcium supplements, which may be okay, we could let them go. But just as a point of education, I would always combine them with at least half the dose of magnesium. So if you're taking, say, whatever, 400 milligrams of calcium, you want to take at least 200 milligrams of magnesium. And you want to combine it with vitamin D and K2, which will help put the calcium in the bones instead of the vessels. But my suggestion is that we actually tweak your kind of nutrient protocol a little bit. Fish oil, love it. I would keep doing that. It's
Okay.
very anti-inflammatory, lots of benefits, especially for neuroinflammation and immune modulation in your case. So I would keep doing about 1,000 to 2,000 milligrams a day of fish oil, and fish oil you should take with food.
Okay.
And then I think from a digestive immune interface, so we'll circle back to minerals in a second, but I think we might want to start building up your gut microbiome. So there's a couple ways we could do this. One, we could do some functional testing of your stool to see what's going on in terms of if you have like dysbiosis or yeast overgrowth or whatever. My expectation is the answer to that is going to be yes. Like we don't have to spend that money. So that's one option. But I do think we should begin to add some probiotics and prebiotic fiber. But the question is, do we first do some antimicrobials to kind of clean up any more like dysbiotic, kind of the when we talk about good bacteria and bad bacteria, right? Like kill off some of the bad bacteria. So, do you tend to be more constipated or more diarrhea or both?
Constipation, um, more common. Yeah, I don't common have diarrhea unless I'm like on my period week. But I did get my squatty potty this past month, which I've been delaying, and that has been helping some of my constipation. But more often constipation or hard stool and like
Okay.
difficulty. Like on the Bristol stool chart, it's like the hard to pass one.
Okay, perfect. So I think I would suggest that we do about 2 to 3 weeks of the more antimicrobial herbs. And I'll send you some specifics. The research around this recommends, so there's a good study from Jared Mullen out of Johns Hopkins, like back in at least 2015, but maybe before then, where they looked at, and this is for small intestinal bacterial overgrowth, but it does kind of generally help the colon overgrowth and any yeast overgrowth. They looked at two different products. They looked at FC-cidal and dysbiocide, or a product from Metagenics called Candibactin AR and BR, which is what I normally use. They're both good. It's just the one I'm more, I've had more clinical experience with, or for people that are really sensitive. And so that study from Johns Hopkins GI department found that a combination protocol of those antimicrobial herbs was just as effective as using antibiotics. And in my experience, it tends to stick more without the side effects to the gut of the antibiotics. So however, if you're sensitive to things, I prefer a product called Biocidin, which we can start really, really low dose first. And I kind of intuitively, that feels like where we should start with you. Do you have like sensitivities to things, or what do you think?
Dairy
Hmm.
is my most significant one, and that's also like I didn't even know how to classify that because it was like middle of college. I went from eating it fine to all of a sudden, like overnight, like getting so violently ill. And there was about like a 5-month period where I just was throwing up like a ton constantly. And they just were like, cut out these things. And they put me on like the low FODMAP. I think we talked about this a little bit, like put me on low
Hmm.
FODMAP, put me on a ton of restrictions. And dairy was kind of the most obvious one at that time. But
Okay.
like on a test, I don't show up as allergic. It's just maybe some lactose intolerant I developed in college.
Yeah. Okay. So to me, that's more of like a sensitivity to that food or the protein in that food or the potentially the lactose, but probably it's the protein that's irritating the lining of your small intestine and you're dealing with SIBO. So let's start with the biocidin because we can dose it really, really gently so that it doesn't make you sicker. And one thing I've noticed with my clients who have really sensitive digestion is that, there's this whole idea that we want to get to the full dose. Like you can do biocidin dosing at like 3 capsules a day, which is like 15 drops a day, 5 drops 3 times a day. For you though, and for many of my clients, we can accomplish the very same thing slower over a longer period of time with 2 drops once a day or twice a day or 3 times a day or 1 drop. We start really, really low and slow.
Okay.
And I find that to be more gentle, especially when you're in the midst of this really busy life. We don't need to be like doing an aggressive detox to your digestive microbiome because you will often have some side effects of a little bit more diarrhea or digestive pain or things like that. And we want to keep that as minimal as possible because we also don't want to irritate your immune system and have it be just more sensitive to everything. So we'll start with a very low dose of that. Of course, I'll send you this all written down, but we'll do some low dose biocidin, and then we'll also start with a really gentle probiotic that's kind of a broad spectrum, but again, low dose. And we'll layer that in, a few weeks after we start doing the antimicrobials. And the one other thing that I'm a little bit concerned about, when do you start your clinical rotations?
July 1st.
Okay. So we're in April. So we have a few months. That's good. I want you to really start thinking about a couple things. COVID, like mitigation techniques. I think for you, masking is just not optional while you're at work. I mean, you're going to be exposed to things in the hospital. So not wearing them all the time now, like whatever you feel comfortable now, but in the hospital, I think lowering that exposure is going to make a big difference. And are you doing clinicals like all in a hospital or any like outpatient clinics or anything like that you're aware of?
My first one's outpatient clinic. My second 2 will be more of a hospital setting.
Okay.
With my third being a skilled nursing facility in the acute care wing.
Okay. Actually, that's not necessarily so bad because sometimes facilities like that, because there's not as much in and out,
Right.
they can be less problematic.
It's a little bit more lockdown, right?
Yeah. And but I would say that and since you're starting an outpatient, that's also good. Now, again, the downside is you're going to be seeing a lot more people coming and going, but depending on the building, and if you need me to write a note for you, I will. But we might want to talk to the owner of that clinic and see if they could just keep the windows open. There's a dramatic difference in transmission of all of these viruses when we're in an environment without airflow. And things like HEPA filters are really valuable. There are lots of ways to do that. That's not very expensive. And the other thing that helps is a thing called a far UV light. So it's actually a light on a stand on a tripod that projects light in the space and kills off viruses and bacteria, just like the HEPA filter and that sort of thing. So, since you're probably going to be hands-on with people and doing manual therapy, masking, but then taking breaks because we don't want to tire out your system. It is fatiguing to wear a mask all day. So taking, stepping outside for lunch, seeing if you could open the windows in the clinic, depending on the time of year and that sort of thing, because we can really mitigate some of the risk without having to be so aggressive about it, if that's helpful.
Yeah,
And the other
totally.
2 things that I use always when I'm traveling is there are nasal sprays that are known to kill, I believe it's 96% of COVID on contact in the nose. So every couple hours, step outside, take the mask off, spray your nose. The product is called Enovid. You can order it online. I can send you links to that as well. And actually, I have some right here. This is a spray called Briotech that we originally discovered when the pandemic first started. We were going to use that. I was working in a office in a naturopathic clinic with a bunch of other clinicians, naturopaths, physicians, and we were looking for stuff to clean like the plinths and stuff with. And Briotech, you can do that with, although you don't really need to now. We can just use Clorox wipes or whatever. But this is really good for the skin, and you can spray it right on your face.
Mm.
So if I'm traveling or whatever, every couple hours, I'll spray my face with that. So I can send you that. That's another option, especially when you're in like an inpatient acute care. Like every couple hours, I'd be spraying my nose, spraying my face, and then wearing a mask. But in outpatient or any place that has windows, one of the best things we can do to mitigate any viral risk is to be outside, and opening windows pretty quickly approximates that. So that's another option if it's even on a day where it just feels too much to wear the mask or you need a break. um, I get that. And it's hard because, these masks they're not comfortable and you've got microplastics in them. There's some downsides to the mask. I don't love it, but it's one of the best tools that we currently have. And especially because we don't want you having to miss um, so much clinical work and then amplify your stress and worry about your schedule and all that.
Right.
So in the meantime, though, we have about 3 months to really strengthen your gut and your immune system, and really focus on the gut microbiome is where the evidence is strongest. Ultimately, I'm going to start you on some very gentle stuff to just the biocidin and the low dose lactobacillus and bifidobacterium, kind of gentle probiotics. And then we want to increase one thing that has been shown to kill COVID in the gut is a bacterial strain called Bacillus subtilis, which also helps kind of remodel the gut microbiome and strengthen some of the keystone species that mitigate risk of, and again, any viruses, not just COVID. So we want to shift to that, but that's a little bit more aggressive of a probiotic. And some people get some constipation from it. It can trigger some histamine issues. So we want to add that in maybe in the next 6 to 8 weeks. We'll start with some gentler things first. And so we talked about omega-3s, apple cider vinegar. I would do that 3 times, at the beginning of each meal, whenever you want to. Omega-3. And there's one other thing that I think would be beneficial for you. And that is a kind of broad spectrum anti-inflammatory supplement. So it's mostly based in curcumin, some of the more anti-inflammatory herbs and spices, just at higher therapeutic doses, which can also be antiviral in case some of these viruses, like the Epstein-Barr, for example, from the mono, is sort of hanging out. We can get it to sort of stay dormant by having a more anti-inflammatory support. And you'll also get that with the omega-3 that you're taking. You could do things like drink more green tea, add more berries to your diet, add more herbs and spices, especially things like rosemary and garlic, and fennel is another good one. Like any of the colorful fruits, vegetables, spices. Cinnamon is great. And we can look later at like your metabolic strength, such as your fasting blood sugar and your hemoglobin A1C and things like that, because metabolic dysregulation can be stressful to the immune system. But given your long-term history with gut dysregulation, I think really starting there is going to be important. And then the final 2 things I would focus on is a balance of microminerals like magnesium and potassium, and zinc is very important for lining the digestive lining, which is the digestive immune interface, a little bit of copper to keep it balanced, and vitamin D and vitamin K. Vitamin D, if you have a chance in the next few months to just see your primary care physician and get your vitamin D tested, maybe get a general CMP, CBC, that could be really valuable too. So we have just your metabolic panel, also your cholesterol, your red and white blood cells. Make sure you're not anemic before you go on these rotations, so you have plenty of energy from an iron standpoint. And then vitamin D, because vitamin D is very strong for the immune system. In fact, the higher the vitamin D level, the more protected you are from any viruses. And then finally, we'll meet again, maybe or maybe not on camera, but I think before your clinicals, we might also think about kind of a more acute viral protocol just to have in your back pocket in case you start feeling a sniffle or anything. We want to kind of get to it quickly before it becomes anything else. But you've got these next 3 months to really rest, to strengthen your gut and your immune system and your gut microbiome. Stay focused on your work, but not have it be just over consuming. And then really practicing, like just as important as your exercise, doing that nervous system regulation. How does that feel? Overwhelming? Good?
Sounds good. Yeah.
Any questions for me?
I don't think so. I think I'm gonna go buy one of those little pill organizers so I can keep all my little things each day. But no,
Yes.
this sounds cool. I'm always excited to like use more, holistic and natural ways to improve my gut. Like I said, for so many years they just tried to put me on like omeprazole, like that super intense
Mm,
GERD medication. And I was like, I
yeah.
don't think this is what I need. So I'm looking forward to kind of not being as anxious about my stomach always hurting.
Yeah. I mean, the goal is going to be to get you a much, much more resilient digestive system and gut microbiome. And that comes from having adequate stomach acid and a lot of robust, good bacteria and feeding those things. That's why, adding all the fruits and vegetables, adding green tea, adding, fatty fishes, adding herbs and spices, like how we eat, we need to start thinking about how we're going to feed our microbiome, not just what can we not eat.
Perfect.
All right, excellent. So we'll integrate that into your schedule. Not a huge change from what you're already doing, just getting a nice pill organizer to get your supplement stack in. And I'm going to keep that as simple and gentle as possible, go really low and slow with that. And then you are really, I think, doing a great job with the exercise balance. And I would also say that, like, keep it really gentle for the next month or so. And then if you start feeling more and more energized, you can increase it a bit, do a little bit more running, a little bit more outside. But I think this sense of enoughness about what you're doing is a really important thing to lean into. Does that resonate?
Definitely.
Yeah. And I think in all ways, I mean, you're doing a lot of amazing things. You're in one of the top PT programs in the country. You're working really hard. You've got a foundation of exercise. So, a sense of gentleness about that and what you had said before, and kind of being more graceful for yourself, to yourself, is a skill that a lot of people have to develop to get to where you are. It took a bit of type A-ness, I bet.
For sure.
So there's a learned skill for longevity and the capacity to do the work that you want to do over the course of the next 20, 40 years or longer requires learning that skill of gentleness and implementing it over the long haul.
I love that.
Yeah. Awesome. All right. So I will send you your list. We've integrated it into your schedule. If you need any other support, think about that and how you can get that added in. And it might just be a little bit of scent spray or a couple new books for a gift from a friend or a family member, like just
Yeah.
allowing yourself to receive some little bits of support is also part of that learned skill of gentleness. Because I'm sure you are super, super capable, but receiving might be a little tough. Would that be true?
That's a little true.
Yeah, I get it. I
Yeah.
get it. Certainly guilty myself. So practicing that. And then, so in step 6 is our support. And then we'll circle back in about 4 to 6 weeks from now and keep refining your goals and keeping you healthy and strong and out of any kind of doctor or hospital office as much as we can.
I would love that.
With any kind of new bugs. So great.
Right.
Any other questions for me?
I think that's perfect. Thank you so much.
You're welcome. Thank you so much for sharing your story. I think it's going to resonate with so many people. And I wish you the best of luck as you keep moving through your program. You're more than halfway done. So that's something to celebrate too.
Exactly. Thank you so much.
Take care.